In today's mental health check, we're digging into a recent study that found an alarming trend for moms in the United States.
Research published in the Journal of American Medical Association found that the mental health of mothers dropped significantly from 2016 to 2023, with 38% of moms reporting excellent mental health in 2016 compared to only 25% 7 years later. Joining us now is clinical psychologist Jennifer Hartstein. Thank you for being with us.
Thanks.
So walk us through what the study found and who was ultimately impacted.
So we found that kind of 1 in 20 women in 2016 were reporting poor mental health, but it's 1 in 12 in 2023. So that's 7 years. That's not a long time for that number to change so much. And the women that are really being most impacted are those that are single parents, not as educated, or have kids on Medicaid or maybe uninsured. So they're already at risk for more stress. So kind of add to just the world as we live in, and it's even worse.
And I know they didn't get into in the study, it was really just looking at the numbers. They didn't get into the why is this happening, but you're an expert, you're a psychologist. What do you think might be some of the root causes?
Yeah, there's a lot of reasons. I mean, I think one that we talk about women a lot is there's general cognitive load, right? We take on so much more, and that's going to be true, especially for single parents. We don't have as much community as we might have had before. There's a lack of kind of national paid parental leave, so we aren't getting the time with our kids to reset and regroup. There isn't access to childcare in the same way as there is in other countries, so that we aren't getting that support either. So there's all of these things that aren't really helping parents in general, but mothers even more.
So how can mothers, I don't even want to say cope, but thrive? Yeah. And how can people around them support?
It's such an important question, right? And I think thriving is what we're aiming for, but like, how about we just get to get through the day without wanting to be in a meltdown, right? And I think community is huge. Asking for help is really important. Sharing that cognitive load, and I think finding people that will step in and say to you, how can I help you, is actually not taking the cognitive load, but someone coming in and saying, hey, I brought you groceries, right? That's a difference, and we don't always think about that.
Like the mental labor.
The mental labor, right? And what boundaries can you set? Where can you say no? Where can you put yourself first? What do you really need?
Yeah, we talk about that here a lot. I'm trying to practice it in
I know,
my
it's
life
one of our favorite conversations,
well.
Kate, I know.
So what if somebody out there watching is starting to feel a shift in their mental health or their mood? What are the steps?
So things we want to pay attention to, right? If over the past couple weeks, are you crying more? Are you more irritable? Are you having a harder time engaging in things you used to like to do? It's for an extended period of time, ask for help. Ask people to get involved with you. And then do what works. Maybe you need to say no. Maybe you can't do that thing you used to do. You need to just kind of set some limits, give back to yourself. And then do you need to bump it up? Do you need to ask your doctor for some support? Do you need to go to clergy? Anybody else you might that can support you?
I love that. In my own life, I call that like my check engine light. Is the light showing, can I maybe be aware before those signals start flaring? We're talking a lot about what the individual can do, what the mom can do, but what about the people around the mom? How can community support?
Well, and I think one big thing is to not be afraid to let someone know you're worried about them, right? And I think we're often afraid, but they have so much on their plate, they don't need me being worried about them too. No, that's so validating. Like, step in, show up. And I think, as a kind of community as a whole, right? How can we start to fight for things like, healthcare support and childcare support?
And conversely, if you're the one that's struggling, it's okay to say that, right? It's okay to turn to your friend and say, like, I'm having a tough time right now.
Absolutely, and I think that's one of the reasons why this study is actually so important, because we are talking about it. And then we are taking the stigma away of the fear of, like, I'm supposed to be this perfect parent. And we don't have to be a perfect parent. In fact, fallible parents are probably more real and genuine.
I love that, and I think normalizing being able to answer the question, how are you, with actually not great, I could use support, that's okay to say too.
100%.
Jen Hartstein, it's always great to have your perspective. Thanks so much.
Thanks.
And we got a lot more news ahead.
You are watching NBC News Daily.